How to get pregnant naturally with twins. Don't shoot the messenger, but again, I'm bearing bad news. You don't have control over everything. But stick around. I'm gonna give you all the information you need to know about having twins naturally. Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fizet. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Hi, I'm Dr. Natalie Fizet. You want to have twins? I don't blame you. They're so cute, like they poke each other's eyes, and they seem to have a bond that's really like beyond nature. But honestly, if you want to have spontaneous twins, it's about 3% chances. The odds are against you. We're having more twins right now because we're forcing nature with all the in vitro fertilization and all those medications that kind of stimulate ovulation. So, what are the known factors that would increase your chances of having twins? Well, the first thing is if you're from Africa, we know for a fact that women from Africa have, and there's some villages and some countries in Africa that have way more twins. And they were saying the hypothesis is that their working grounds is that they eat more yams and there's more estrogen in yam. So eat more yams if you want twins. I don't know if it's gonna work. And they were eating yams like 3 times per day, honestly. The other thing is inherited. If you have twins in the mother side of the family, you have more chances. The other thing is if you have a lot of babies, then it's as if your baby machine is been primed, so you have more chances of having twins. I've had a patient that had 3 sets of twins, and she got called by the local university hospital saying they wanted to, get in touch with her. The last two factors for having spontaneous twins is if you're taller, a tall woman, you have more chances of having twins. And if you're over 30 and especially over 35, somehow Mother Nature and she heard your call. Let's say this. She favors like you peak your FSH, follicle stimulating hormones, so you're kind of pushed to release more ovules every month, and you have a higher chance of having twin pregnancy after the age of 30 to 30. Since this video is about having twins naturally, I'm not going to talk much about in vitro fertilization. There's great videos about doctors that work in fertility clinic. They're way more qualified than me to talk about this, but I can say that you have more chances of having twins if you have in vitro fertilization, because usually they implant more than one embryo. They used to implant like 8 or 9, and then if they all took, they would make you choose like, okay, let's remove a couple of embryo, and that was like really heartbreaking. And Sophie's choice, like you would choose which, and then the patient would have a miscarriage because they kind of poke. So that they don't do that anymore. I think they implement 2 or at max 3. There's some doctors in some countries I heard still like pushing fertility drugs and implanting in vitro like many embryos, and that's tampering with nature, and I don't agree with that because you get premature baby, you get sick babies, and it's kind of selfish just to get like in the Guinness World Record book. By the way, the Guinness World Record book is 9 babies. Somebody just pushed away Octomom Nadia Salaman, who is famous for having 8 babies, but that was like tampering with nature. It was not natural. So this young woman, 25 years old, had 9 babies. we don't recommend this. You know, you're gonna have sick babies. They're not like they don't live to their full potential. Potential. Human are not meant to have nine babies at once. We're not like dogs or whatever. All right, you made it. You're pregnant with twins naturally. Congratulations. They say you should take the same amount of folic acid. Do expect to be. I always told my patients that were pregnant with twins, see double because at the birth there's two doctors. There, the gynecologist, and there's the. For me, it was a family doctor, me myself, and the gynecologist because we have to take care of baby number one and baby number two. There's like two nurses because there's two babies to take care of. And double, not double the weight gain, but more weight gain, definitely. And you have to know that if you're 30 weeks, it's as if you're 38 weeks pregnancy. So don't expect to work until the very end of your pregnancy with twins. That would be unreasonable. So you have to say at 30 weeks, I'll be home, I'll be resting, I'll be reading all the books that I wanted to read all my life because you're not going to be like walking around. There's more prematurity with babies because there's more weight. So sometimes the water breaks, so you have to be off your feet. A fun fact is that they did some studies and they know that twins interact in the womb, which is kind of obvious for me. Like, you know, they're so close to each other. I've had a delivery of twins and my patient did beautifully, but when the first twins comes, if you can imagine, it kind of creates a void, like the baby comes out. So the second twin sometimes will tilt over and can go in a transverse slice and the head is not like placed properly. So sometimes we have to do external maneuver to place it or deliver a breech baby for the second twin. To deliver vaginally for twins, you need one thing is that the first one is head down because if the first one is breech, you can imagine that the head is higher and let's say the second one has the head low, they could like interlock and not come out. And the first one is halfway out, so that would be like a catastrophe. So yeah, once the first one is head out, you can have a vaginal birth. And the second one, even if it's head down, it could flip and go breech and then we have to make sure it goes in the proper position. So getting back to my patient, she delivered the first one beautifully. And having twins is kind of a bonus because once the first one is out, you are fully dilated. Sometimes the cervix will reclose to 9 centimeters, and we have to wait like an hour or 2 hours to get back to fully dilated until the second baby's head like engages in the pelvis. And that's fine. Like, let's wait. The heart is fine, the baby's fine. It's just taking its time. So, but you don't have to wait like 12 hours to dilate because the cervix is really soft and it's usually like 9 or 10 centimeters. Most twins will be born like within 15, 10 minutes apart. So her first baby was born, and usually we put baby on mommy for doing skin to skin and everything. But with twins, we have to make sure, like, replace the second baby, make sure it's head down and the cord's not before the baby. So there's things to be checked. So the baby was on the warmer next to us, and it was like screaming like ah! And the poor baby was like there was and the nurse was trying to calm him down and he was screaming. So sure enough, the second baby came out and the nurse put the second baby next to the first twin. And what the first baby did is reached out with his arms and touched I'm getting emotional every time I tell that story. It touched the second twin and it got all quiet, like all calmed down, saying, "Okay, I found my twin. It's safe and it's okay. It's next to me." And then we put both babies in mommy's arms, and she was fine with that. I'm as a doctor that delivered 3,700 babies, and over a 25-year period. I was always torn by this situation, and I would like your comments below on this one. I'm an open book. I tell everything to my patients like it is. Whatever I know, they know. So I'm not like the higher power, and they're part of the process. But so often when the baby would come out and then the placenta would come out, if they had like one baby, not, we're not talking about twins here, the placenta would come out, and I created an image out of a flower, actually a sunflower, but it shows you what I mean. But often I would see that the placenta had the regular placenta and a smaller placenta next to it, and really definite different placenta. So there's so many more pregnancies that start with twins and end up with just one baby. Because if the babies are on the same bag, often their cord will twist and one baby will not develop or pass away, and then it's what they call the vanishing twins. I would always tell my patient, but then she's got her baby on her, she's happy, so I would always like, should I tell her, shouldn't I tell her? But then it's part of what happened, it's part of, and it's part of me telling it like it is. And if I have information my patient had as much, and her spouse of course had as much information, but I saw that so often. So there's way more twin pregnancies. The problem is when they're in the same bag, when they're a single egg that's separated, but there's no membranes in between. There's so much trouble that can happen. So let's start with the beginning. What's the difference between identical twins and fraternal twins? So identical twins are one egg that separates one time more than the usual separating patterns that we see in the development of an embryo. And then they have the same genetic material. By the way, they don't have the same fingerprints. Okay. I was just thinking of a friend that said, why do they have two driver's licenses? He saw 20-year-old girl twins, and he goes, well, they should have, and there's that stories of, taking the math test, and one is good in math, and she took the math test twice and so forth. But it's funny. They do look alike because they have such similar genetic material. But honestly, they're different. They're two different individuals, and they have different fingerprints, honestly. So you could tell them apart. Some The parents can tell them apart usually like in a second. I had one dad that came to an appointment with the twins. His wife was back to work and she was busy, and I said, okay, let's start with, and I named one of the twins, and he looked like, he goes, oh, she has a birthmark here. So he goes, that's the one. And he gave her to me. So that's how he could tell them apart. But most parents can tell their twins apart, like just by looking at them. They're two different individuals, but they're kind of bonded in a very special way. So they're identical twins. They're not that common. The other set of twins is fraternal twins. It's two eggs that been fertilized by two different sperms, and they could be from they're like siblings mostly. They could be different sex. I've had a friend nurse that had fraternal twins, and it was a boy and a girl, and people would ask her, are they identical? And every time she would go, they're a boy and a girl. How could they be identical? She would get that question so often, which was pretty funny if you think of it, because a boy and a girl, there's no way they can be identical. So that concludes our topic or video on twins. And as you can see, your odds of having twins naturally are not that high. If we talk about having twins in fertility with all the medications and everything, yes. But if you don't have any medical reason, first, start trying. Take your folic acid, of course, to lower your risk of having neural tube defects and all that stuff. See your doctor for a prenatal preconception visit. But don't jump into fertility drugs because I've had one of my patients that she took the injection, the FSH, follicle stimulating hormones, which is to like kind of force your eggs to come out. And she was telling me the story like she was in a car with her husband and they were going to the clinic to do the ultrasound to see how many eggs she had. And she had to lie on the back seat, but on the floor because she was cramping so much. And once she finally got to the clinic, they did the ultrasound and they counted she had released 32 eggs, which is not natural. So yes, you can, and honestly, you have keep in mind you have a 3% chances of having twins naturally. Trust nature. She'll give you whatever you need and in the quantity you need. That's all I have to say. See you in the next video.